And so now it is time for the special of the day, because we have been talking about grief. A lot of times I get this question, and when should you use medication? People ask this question because sometimes they're not sure if their grief and if their depression or if their anxiety is severe enough to need the medication, or they should stick with counseling or therapy or other kinds of approaches. And so let me try to answer that question for you today. If you're interested, stay with me so you can decide what level of care you need. All right. So depending if you should use medication or not depends on the level of symptoms that you're experiencing. Let's say if you are having some symptoms like some problems with sleep on and off, some problem with anxiety on and off, but you're not having severe symptoms, then you can use a lot of relaxation exercises, self-help, mind training to help you get through that phase. Let's say if you are having more significant symptoms that you are not able to get better with self-help work, then seek out therapy. Work with a counselor, work with a psychotherapist who can help you get over those mental obstacles that may be preventing you from getting better. If that is not working, or even if it is working, you may need some support of, let's say, some herbal supplements, some natural supplements. Somebody's going through grief, they are working in therapy on the grief issue, but their sleep is disturbed, and maybe having a natural remedy like using magnesium, or using melatonin or GABA or L-theanine, or there are different type of herbal supplements that are available that may help you sleep better until you are able to get through the psychological obstacles that you're facing. There are times when symptoms are really severe. You're really into severe reactivity mode, severe anxiety mode, severe depressive mode. Your sleep is totally disturbed, and so you're in severe depressive phase. And trying to work in therapy is really hard at that time because you don't have the energy, you're not able to sleep. And in those situations, it is okay to take medication. It is okay to see a medication provider who can give you the medication, choose the medication with least amount of side effect, with highest and least risk of, let's say, dependence. Because that is another question that people have. What if I take a medication and it makes me dependent? Because there are some medications that can make you dependent, right? So you want to work with a good provider who can walk you through, have a plan. Okay, this is the amount of medication you should take. You should not take more than this or not longer than this. Otherwise, your risk for dependence increases, and help you through that phase. So help you taper down at the appropriate time. While you're working in therapy, while you're developing your mental resilience, you can use the medication to decrease the severity of symptoms so you can come out of that dip and be the best self you could be. And so I hope that answers your question. If you have any further questions, please feel free to send me the question by hopping to happyandhealthymind.com and send us the questions, and I'll try to answer in future programs. At this point in time, I leave you with the question: what do you choose? Are you going to choose to allow the circumstances to lead your life, or are you going to take the lead of your life? Every day is a new day. Every day is a new choice. You have the opportunity to choose whatever your response to your circumstances is. Circumstances are not in your control, but how you respond to them is in your control. Make wise choice every day. Stay safe and healthy. Until next time, Dr. Rozina.